Good morning and welcome back to Michigan's Big Show starring Michael Patrick Shields. With you today is Mel Seifert with AARP. I am extremely excited to have on our next two guests, two powerhouse women with me today that have made it their mission to lower the cost of prescription drugs in Michigan. I have with me Senator Ruth Johnson from the 14th District and resides in Holly, Michigan, and Senator Winnie Bricks, who represents the 29th District and is the first woman to represent Grand Rapids. Welcome.
Thank you.
Thank you so
to be
much.
Here.
Yes, thank you. So I'm going to start with Senator Johnson here. So you have introduced this bill, I don't know how many sessions, 2 sessions in a row now, maybe even 3, to import pharmaceuticals from Canada. Can you talk to us about what that bill would do and why it's so important for Michiganders?
Sure, and Melissa, I think you were with us there when we had a big press conference last time and a rally in Detroit with the Ambassador Bridge in the background when we introduced the bill. And I do want to thank AARP for being such a great partner in this fight for affordable drug prices for
Absolutely.
those that need them. And Michigan residents shouldn't have to choose between filling their prescription and filling their pantry. And as you know, this really impacts a lot of seniors, but also those with chronic health conditions. So my bill would allow the Michigan Department of Health and Human Services to establish a Canadian drug importation program to reduce the cost of prescription drugs for Michigan's consumers. And it would require the same track and trace standards the FDA uses for U.S. pharmaceuticals to ensure the authenticity and the safety of the prescription drugs that are imported. And the disparities between what we're paying here in Michigan and America and what we're paying, what they're paying in other countries. And I'll just give you 3 real quick ones. Entecort, that's for Crohn's disease and ulcerative colitis. In the U.S., it's over $2,000 for prescription. That same prescription in Canada is $238. That's an 859% increase. Or Januvia for diabetes, $1,355 here in the U.S., $371 in Canada. That's a 364% difference. And Spiriva, that's for COVID, COPD. Mm-hmm. That's $1,306 in the U.S. and $281 in Canada. So that's a 464% increase from just going across the bridge or the tunnel. So a friend of mine that I grew up with in my neighborhood in Waterford, she was a senior and had a chronic health condition, and that trip across the bridge to Canada is how they were able to get their medicine and still afford other necessities. So
absolutely, for the same drug, too, and that's what's so frustrating about this.
It is so frustrating.
It is.
And it's even harder with COVID, and a lot of people don't live near the border. We just need to fix this.
Absolutely.
And I know you hear all the time where people say they fixed it, whether it's at the federal level or state level, and it's simply not fixed. So
that's right.
So, and I do think pharmaceutical companies deserve credit for developing medicines that save and improve lives, and I don't take that away from them. But, I think they do need dollars for research and development, and they do deserve a fair profit for their work, but I don't think profit for their I just don't think that's what this is.
I agree. And we have Senator Winnie Bricks here, too, to talk about, nobody really understands why these drug prices increase so exponentially year after year. And so you have new legislation that would create a drug affordability board. Would you mind speaking to that, please?
Sure. First of all, thanks for having me on. This is a great time to talk about this as prices are going up, and we know that prescription meds are useless if people can't afford them. So it's kind of an all-hands-on-deck approach to coming up with some innovative ideas in the legislature to try and make a difference for our constituents on the prices of the meds that they need. My legislation would establish an independent board of experts that researches, they review, they establish upper price limits on the most expensive prescription medications. It would be a public board with opportunities for the public as well as other stakeholders to weigh in. It would be appointed by the governor with advice and recommendations from the legislature. So it would really ensure that we go beyond transparency and we go beyond just addressing certain drugs that we know we can get cheaper from from Canada in making sure that we are having a comprehensive way that we study the cost of these drugs for people who are experiencing not just rare diseases, because we know that those can be incredibly expensive to treat, but also really common drugs that people need for cancer, for COPD, for lupus, MS, epilepsy. I think every one of us knows somebody who really struggles with the price of those medications for those conditions. And this would allow that body to examine those high prices and to determine an upper limit cap for any consumer to pay. So
Absolutely.
It goes right to the source of the prescription drug pricing, right at the manufacturer level, and it prohibits any pricing throughout that entire supply chain distribution process from the point of manufacture all the way to the end consumer, the patient. It prohibits them from charging beyond that price. So it automatically keeps prices down at every point in that supply chain.
Yeah, that's so important. And we know that 1 in 3 Michiganders are not taking their medications that they need, citing that cost is the reason. We know this is a big issue for our members. So, these bills have been introduced. They seem to be kind of, holding strong in the introduction phase. So what can our members do? What can constituents do? What can Michiganders do to push these bills over the finish line to make sure they get heard in committee and then hopefully across the governor's desk?
They can certainly write to their own legislators and talk to them about the value of these pieces of legislation and talk to them about the impact on their actual lives, right? Mm-hmm. Talk to your legislator, tell your personal stories and why this is important, but also write an email or a letter to the chairperson of the committee and to the leadership in the legislature and ask them to take up this legislation. They control the agenda, and they have the power to have this conversation. So really urge them to do that, too.
And then, Senator Johnson, we have a minute left here. Any tips that you can add on to that?
Yeah, Senator Winnie Brinks is exactly right. We need to push the legislature, and my bill did get a hearing, but it didn't get a vote back in 2019. We need to hold our elected officials accountable. It just doesn't make sense that we're paying substantially more than people in Europe or Canada or Japan. I understand when it's a very impoverished country, but these are other countries, and we're footing the bill on the backs of our seniors and others that might have chronic diseases, and that shouldn't be where it's at. And they seem to have a lot of power to be able to slow us down or stop us. So the best thing we can do, the most important thing we can do, is have grassroots efforts and make sure you contact those that are elected and push them. Our push has got to be harder as citizens than the push back by companies that are charging sometimes 1,000% more here.
Couldn't agree more, and that AARP has your back, and we will do all that we can to get this done. So I want to thank you both for coming on. I hope you both have a great day.